Hi, good evening, everybody. This is State Representative Dave Rutigliano. I have the pleasure to be joined by my friend, Peter Tolk. For full disclosure, Peter's not only my friend, he's my neighbor. Our kids went to school together. I believe they played Little League, and our wives are friendly. So it's really awesome that you would take some time out of your busy day to answer some questions that people have wrote in. So just for the people who may not know, Pete, can you just go over what you do for a living and what your qualifications are?
Sure. Well, thank you again, Dave, for having me. Pleasure to help out. I am a clinical social worker. I've been a social worker, probably 25, 30 years now. I do have my PhD in social work. So, but I've always remained in the clinical realm. Just in terms of my background, I've worked in hospital settings. I've worked in agencies. But really, for the last about 20 years, I've worked in school systems. I've presently been in Fairfield Public Schools for about 18 years now, and in conjunction with that, I have a private practice where I treat families and individuals in Fairfield as well.
So what's the age range of the students that you see, Pete? Do you go all the way from like kindergarten or grammar school all the way to high school, or do you just sort of have a focus on adolescents or high schoolers?
In my school job, actually, I am assigned to an elementary school 2 days a week. So that's kindergarten through fifth grade. Then one of my other function in Fairfield is I'm on a consultant team for the private schools in town. So that has me working with kids actually in preschool. If a preschool has a kindergarten, then we consult. So sometimes I work with the little ones, but it does go all the way to high school as well. For instance, like Notre Dame of Fairfield Prep are located in Fairfield, so I do work with them. That's in my school job. In my private practice, I do a lot of work with adolescents. I see families. It really depends on the case. I'm certainly not going to take on a case that I don't feel that I can be helpful and have the skill set for.
So I guess we made the point that you're sort of in touch with what's going on with youth. You deal with students. You deal with students' normal stress. And I guess we could say that this is an abnormal time right now between the outcry I've heard, and I'm sure you had in our own community from parents, and the stress that students have been under and how this is such an unprecedented situation. I did put up online for people to write in questions. I've got a bunch. Some of them may be similar, but I really appreciate you taking time to answer and maybe, help parents like myself and other folks really navigate this uncharted water that we've all been in. Because I can just tell you from my own personal experience, it's very stressful. It's very stressful for my high schooler. I have a freshman in college, and it's sort of disrupted their life. I'm sure you have kids, and I'm sure it's a similar situation at your house.
Yeah, no, it's stressful for me as well. I have a freshman in college and a senior in high school. So, their lives and our lives as adults have things have changed dramatically. So yes, it is a tough time for everybody.
So I'll go to question number one. And the question is, can you describe in your professional opinion what mental and emotional effects the lockdown and all this social isolation is having on our children?
Sure. Well, first of all, I think as parents and adults, we have to kind of have a sense of and process how it's affecting us. Because I think, once we can kind of wrap our heads around how it's affecting us, then we can kind of try to delve in and help our children. I will say that, I think the whole social isolation piece, I think probably the kids may not feel as isolated as we may think, because they're pretty adept with social media, with FaceTime, using this medium, which is, has been foreign to me up until a couple months ago. So I think, first of all, come to grips with our own stuff. But, so I think a lot of people probably assume that, that there's a real heightened sense of anxiety due to what's going on. And, I think, before you even get there, you have to kind of have an understanding of what your child's emotional makeup is prior to this even happening. Some kids may be able to take this in stride. I mean, kids that are experiencing anxiety, it's important to know that there's different types of anxiety. Someone with generalized anxiety is certainly going to react to this. Someone with obsessive compulsive disorder, which is a type of anxiety, would react to this. What I'm finding in my work, kids with social phobias are doing okay because of this, because they're at home, they really don't have to interact with people as much. Going to school can be a very frightening place for someone with a social phobia. So to speak more about the generalized anxiety and like OCD type, I think it really goes back to just you have to kind of have a sense of the environment at home, how you respond as a parent to anxiety-provoking situations, what you may be doing when your child is anxious, how you're helping them through those situations. There's actually a psychologist out of Yale who I've consulted with a great guy by the name of Dr. Ellie Leibowitz, who's done a lot of work on childhood anxiety. And he's actually come out with some new research that is great. This program is called the SPACE program, where he looks at how parents accommodate their child's anxiety. So if a child's afraid to, say, drive down a certain street when they're going home, the parents aren't going to drive down that street. So just quick and, so to address this, I mean, it is kind of more of a holistic approach, how you're processing the anxiety, understanding your child's makeup, and then also, kind of looking at the environment and seeing how you can kind of address things.
It sounds like you're saying that even though the child may have anxiety, or this may even heighten certain anxieties, we as parents still play a pretty large role in how it affects them and how we could sort of help them work through it.
Yeah, I think as a parent, having some sense of confidence that, we're going to get through this together, we're going to be okay, we're going to, we're going to be mindful in how we address things. I think that goes a long way with kids. In my practice, I always, a lot of my work is really helping parents find their confidence in understanding how they can kind of really support their kids through. So I mean, I think that's kind of a quick and dirty, way to address it. That makes sense.
It does make sense. So question number 2 is how best to achieve balance between protecting a child's innocence, which is something as parents, I guess we've all tried to do, and keeping their anxiety and their stress low, while also informing them of the gravity of the situation that we're all in right now. So I guess where's the balance of keeping the kids sweet and sort of letting them know that the world we're in a special, an odd place in the world, and there's a lot of stress out in the world.
Yeah, I mean, that's a big question. I guess a lot of times when, when I work with parents, or usually it's adults coming in and saying, my child's suffering from this, or my child's dealing with this. I kind of want to know what the child, I mean, I would just ask, what do they know about what's going on? I mean, sometimes just asking them directly, wow, it's awful. Schools are closed. There's a lot of stuff that we're hearing about in the news. What do you know? What's going on? So kind of having a sense of what your child actually knows about what's going on is helps as a starting point. Because I think
so are you saying that they probably know more than we probably think they know? So any stress that we may have, talking to them about it, is they probably kind of have a sense of what's going on?
Yeah, it could absolutely. It could be that way, but it also could be that some kids are just thinking about, I can't wait to get on Fortnite because I got to get my homework done so I can play my video games, and I don't know why my parents are complaining in the other room. Yeah, I mean,
Yeah, right.
I think having a sense of what they what they know is going on around them, kind of creates your starting point to address this stuff.
It kind of makes sense. Yeah, it's true. I guess even for some kids, there might be stress in the world, but yet we're all sitting around the dinner table every night. And maybe that's an unusual thing in other times, that it actually there might be some positives for them.
And I mean, you want to kind of craft your response around what they say, because in some of these situations, you might be giving them an education of stuff they don't even know and they don't need to know. So kind of finding out what they're thinking and where they're coming from is usually a good starting point.
It's a very fair point. So next question was, do you have any suggestions of how to effectively schedule for school while they're at home? This seems to be a large topic out in the world. How do we keep them on some sort of normal schedule where their sleep isn't disrupted and they sort of have a normal day? I guess parents are really looking for strategies, because I guess the kids just sleep. If left to their own devices, they stay up too late, they sleep too late.
Yeah, I mean, again, I think it really starts out with what type of family were you before this happened? Were you pretty regimented, or were you kind of loosey-goosey with rules and how you the expectations you had for your children? Now with kids homeschooling, people are, excuse me, working virtually from home, parents having to work at home. I mean, it's just thrown everything in a real tornado, so to speak. So I think it's, to kind of impose some structure on your children when you haven't really imposed any structure before is, can be kind of challenging. I think that, maybe a starting point would be to kind of try to mirror the school day, or mirror like a shortened school day. Because my understanding is most school systems have a sense of how much time the kid should be spending. If you really, honestly, if you really need to have if parents kind of want a concrete answer as to how much time their kid should be doing, I think I would reach out to their teachers and kind of get a sense of what the expectation is, how much time should they really be spending on their studies, and then kind of, go from there. But kids need to get up and move around. They need to get outside. As I say to lots of people, I mean, since this has all started, I'm sitting down more than I ever wanted to.
Yeah.
It's kind of rough.
But I like that you said that, there should be some normalcy to the day. They may not need to get up at the same time they would when they needed to grab a bus in the morning, but, finding a reasonable time and sort of going through your classroom day might be helpful. At least
and I mean, most of the teachers I know, I mean, they have very realistic expectations. Some of them are home with their own children. So they understand that this is, these are tough times. I think people are very accommodating, but just within reason. I mean, there should be some time that they're sitting down, and then some time to move around. I mean, again, this is assuming a child learns in a typical manner. I mean, there's lots of children with different exceptionalities, special education needs that sometimes they're not going to fit in the normal box. And it is it's very challenging for kids that don't learn don't fit in the box and don't learn in a traditional manner. So that's a whole nother story and could be another conversation.
I think we're actually going to be having that conversation coming up too, because we're hearing that an awful lot, that there are alternative ways of learning and kids don't fit into every box. And it's causing quite a lot of anxiety and stress there, at least amongst the parents. This wasn't one of the questions, but I was talking with a parent today, and their biggest concern is how in the world are we going to reacclimate these kids to school come September? Some of these kids aren't traditional learners, or they have, they might be special ed or special needs. And how do we get them back into the school system? I thought that was an interesting question that we hadn't really pondered. Guess we thought the kids would just get right back in the bus and go. And that
I think there's definitely going to be a lot of anxiety. I don't think there's going to be parents that aren't going to be so quick to just send their kids off to school in a large public environment without having a real sense of what the safeguards are going to be. I mean, it's going to be challenging, but I'm encouraged that I think we have a lot of time to plan for that. I think that this is kind of an ever-changing situation, so we'll certainly know more in the coming months.
All right. So the next question was: is there, or should we limit the amount of screen time the kids are getting, time in front of electronics? Because I know they have electronics all the time now, but now they're almost required to be on the electronics for school. Yeah. So it sort of changes the dynamic a little bit.
Again, I think it goes back to what is reasonable. Like how much did you allow your kids to have that screen time before? Yes, I mean, there's additional screen time because they're learning through the screen. So, I think you gotta temper a little bit, and it's important for the kids to get up and move around. I think, certainly after they've spent some time doing their schoolwork, I think, taking a break, getting outside, getting some fresh air in a safe manner is important. And then, I think, one thing to understand, I mean, a lot of these kids, the screen time is their socialization time. I mean, it's when they're connecting with friends, playing games, just even, talking while or watching their friends play games. So I mean,
Right.
the screen time is used to socialize as well. So there's got to be there's some happy medium. And again, like I think it really goes back to the expectations that each family may have.
So that leads to the next question, which I must say is partly my question too. Um, my son says that Xbox is the only way he gets to talk and interact with his friends. However, it seems to be a never-ending game time. Do you believe these types of interaction are harmful? And if so, how does the parent, do we effectively limit it without starting a huge fight? I know it's a long, awkward question, but every time I think one of my son's on Xbox too long, I invariably get, what else am I supposed to do? This is where my friends are. And I'm like, well, okay, but I don't know if 6 hours is, how this is supposed to go, but I'm not really sure. And he doesn't really have anything else to do.
True. I mean, if it's many hours every day, I would kind of think of some alternatives. I could think back, I mean, our older sons are the same age. I mean, I could think back where there was a time, I think my son was, my wife and I were wondering why I wasn't hanging out with friends or something. There was a Saturday or something. He seemed kind of down in the middle in the beginning of the day, but at the end of the day, he was happy as a clam. And it turned out, he was gaming with his friends all day, and he was socializing, and that was, I mean, it was a bunch of years ago, but we kind of realized that.
Yeah. So you think that socializing, you think that is still social interaction there's some positive to it?
Yeah, there's positives. I mean, certainly you want to have a sense of who your kids are communicating with. You want to, I always say, are they virtual friends or are they actually real friends? I think, you want to make sure they're real friends. And yeah, I mean, there's got to be some limits, but honestly, in these times, on a rainy day, what else are they going to do? If they're playing a pretty benign game and talking to friends and seem happy, I mean, I think there's some value in that.
That was a really smart thing. I think you just said, I hadn't thought of it, but are they real friends or virtual friends? Yeah. And you know what? That's kind of common sense. I hadn't thought of it that way, but you're right. I mean, I'm lucky with one of my sons, and I'm sure your son too. He's really kind of interacting with his friends, the ones that he would be playing basketball with if he could. So,
and I've actually, I'll let you know. I have some older clients that I see in my practice who I've known for quite some time, and one in particular is someone who has these virtual friends. But I mean, these are friends that this individual met, I don't know, 10 years ago, playing a particular game when it came out, and in a very I guess in a kind of a graduated fashion, he got to know these people, play the same game, and they're actually, our friends. They're just, he's never sat with them face to face. So, but still, overall, with the school age kids, I am pretty hypersensitive about making sure they're real friends versus the virtual friends, especially.
That's good advice.
And also, I would say, just add, in these times, for people that have, bad intentions, this is kind of a fertile ground for them to do some negative things. So that's why, even though, yes, the electronics are a way for the kids to socialize, I would be even more prudent in these times just to make sure that, that your kids that they are real friends and appropriate friends.
Good. Smart advice. Number 6, can you highlight the differences based on a child's age? This person is particularly interested in pre-K children who do not have the routine and their friends anymore. I guess this was a pre-kindergarten child that either went to preschool or play dates, and it's sort of all been stopped. So they want to know if it affects an age child differently than an older child.
Yeah, I mean, that's kind of a challenging question, honestly. Without knowing, if I had a particular case, I don't think one size fits all. I mean, it depends what the routines are with the child. If the child has older siblings or other siblings, there could be some ways that they could, interact and have, if there's already a routine in the house, say with older siblings, maybe there's something age appropriate that the younger one can do. I don't know. That's honestly, that's kind of a hard question because there's lots of factors that could play into, how you manage a younger child.
It sounds to me, if I can interpret what you said, is that maybe the other siblings in the house or their parents could sort of fill the void that was left by them not seeing their friends or going on a play date. Maybe they could add on time with the younger child to fill in what would have normally been friend playtime. Am I reading that
Yeah, I
right?
mean, yeah. No. I think that's right. I mean, then again, if the older kids are in school or have different demands, it's hard. It depends. It depends on really depends on the family situation. I don't know. That's a good question, but I guess a challenging question for me
Maybe,
without
maybe
knowing all
too
the
long of
things.
an answer for Zoom, possibly, right? It might
Yeah,
be individualized. I hear
yeah,
you.
exactly.
So the next question was, anxiety and emotional distress seems to be running very high. Not only are students missing their friends and freedom, they're also worried about the virus. This has lent itself to many reports of emotional outbursts, uncontrolled crying, behavior issues. So I guess we could all recognize that that's true, but this person wanted to know if you had any strategies for parents to navigate through that very tough time.
I mean, my I don't know. My guess is that in a lot of these situations, I mean, some kids might have a longer fuse where there might be some symptoms that are happening along the way that you can kind of try to head off at the pass. I mean, some kids will keep a lot in and then just kind of explode. I mean, I think it's, in all these situations, kind of what I was, when we were talking a little bit about anxiety before, I think, just validating their feelings. I mean, letting them know that you understand that this is a tough time, that you're dealing with tough stuff too. I mean, you can't tell your kid just to like just to snap out of this. It's not like it's not like you've broken your leg or something where things are going to get better in a prescribed amount of time. I mean, there are some unknowns. So I think just validating that and normalizing what they're feeling, and maybe share appropriately how us as adults are feeling. Just say it's a challenging time. I feel the same way. Um, have to be a little careful. I wouldn't share, you have to kind of be careful knowing your own child, how much you share of your own stuff. But I think, a big piece is just letting them know that it's okay, that, I get it. I understand how you're feeling, and, we're going to get through this together. We're going to do the best we can.
That's very good. Very good advice. Next, how do we recognize when the issues have escalated to a point where a parent should call for help? We get that a lot. There's a number of questions that came in about, geez, I don't know whether it's the last question I just asked you, anxiety, a little bit emotional outburst, or has this gone to a point where I should reach out to somebody? And then they want to know, who do you think that somebody is?
Yeah, I mean, I think when you see some noticeable changes in your child's behavior, if they don't seem to be themselves, if they're if there's just changes, I think that would be a time. I mean, I think I just think that I like to be proactive. I mean, I think that for all parents, and the school staff may not like this response, but I don't want them to inundate the school counselors in Trumbull, but I think I know a lot of the counselors, the social workers, the psychologists, the guidance counselors in Trumbull. I think they're all wonderful, highly qualified, great people. I think, just maybe even just having a check-in, just to, get a sense of if there's any opportunities, even if there's just a one-time, say a Google Meet or a Zoom meeting that they're doing just for typical kids. If your child isn't in a group, sometimes it's good just to have a kind of a check-in. But again, like the first signal would be if you're seeing some changes in their behavior. If they seem a little bit more withdrawn, if they're acting out in a fashion that
And you're saying not just like a bad hour or two, you're saying maybe, my understanding,
yeah, over time, yeah,
over time.
yeah. But I mean, if their reactions seem to be kind of a little bit more heightened than normal, I mean, that would be something I would keep an eye on. And if it does continue, then I would I would first start with the school staff, because the school staff, again, they're very well trained, great people, and they probably have a sense of, they know our kids pretty well, and they have a sense of what's
It's a good point. It's a good point.
Yeah.
So next was, how much of this is some parent taking the opposite approach, and I guess they wanted to know if this was the right way or not. How much of a role should parents have? Should we allow our children to figure it out for themselves? And what do we do if the child is defiant and just seems not to care? I think this parent, when I got the email, was kind of talking about homework and schoolwork, where the kid was frustrated and like, I don't care, I'm not going to do this, and was sort of being defiant. And I think this child may have been older, and they're like, well, you know what? I don't know how much I'm supposed to get involved with this. maybe I just let them suffer the consequences. I think they just wanted your opinion.
Yeah, I mean, in a situation like that, I would reach out to the if the child's older, maybe reach out to the guidance counselor, reach out to the if it's a particular class or a few classes that seem that the child seems to be having some difficulty. I would maybe reach out to that teacher and just see what the expectation is, and
Right.
then kind of work from there. And then if the child is really given a lot of pushback, I mean, could be that maybe the child's depressed. I mean, maybe that could be a sign of depression. Some of this acting out. Whether it's clinical depression is another story. But yeah, I would kind of want to know what the expectation is first, and then maybe ask what should I be doing as a parent. I always say to parents, the parents that I work with, that really homework is a contract between the teacher and the child. The parent's really there to facilitate, but if things start to really break down, that's where I think helping your children to have an appropriate voice with their teacher, and kind of trying to help build that their advocacy skills is real important. So I don't know. That's
Self-advocate is what you're saying?
yeah. I mean, if the child's frustrated, I mean, I think in appropriate situations, I mean, they should just kind of discuss with the teacher what's appropriate and what's not, or how could they make this assignment doable. Again, this is a lot of the teachers have been thrown into becoming virtual instructors when they didn't bargain for that. So
it's an impossible situation. But I will say there was many questions all about, and I didn't know exactly. I sort of tried to condense it into one and two, so I didn't ask the same thing over and over again, about kids feeling overwhelmed. Like, oh my God, my child is doing twice the work they were before. They're overwhelmed. They're frustrated. I would love to have some strategies on how to help my child, because they feel they do more work now than when they had school. So there was quite a few questions along that same line about how do I help my child get over the frustrations or that feeling of being overwhelmed.
Yeah, I mean, it's I mean, if you think about it, when kids are in school, I mean, the older kids, they have their class, then they have a break, they're walking around, it's a movement break, they're walking from class to class, so they have that built-in break. Now when they're just, some of the kids that get up early and they want to blast out their schoolwork, I mean, they're sitting in front of a computer for hours, and it could be frustrating. I know, actually with my high school senior, I know there's times where a lot of teachers post in the morning, but then teachers will post at different times during the day. And I know that's been frustrating for my child, because, thought they were done, but now something else comes. So I mean, I guess that's—
I've heard that one a few times in this house, I gotta be honest.
Yeah, I mean, I guess that's where just kind of having a sense of what your child's frustrated about. Is it just overwhelmed? Are they just kind of done, and the honeymoon period of being in front of a screen all day has worn off? I mean, I would kind of want to know where the root of their frustration is, and then I think you can intervene accordingly. As I said earlier, I think depending on what it is, I think teachers are always open to giving feedback or giving suggestions on how the work should be done, or sometimes some kids might just need a mental health day. I mean, with this virtual learning, kids that maybe were sick and wouldn't go to school are now at home and they can do the work. So I think, partnering with the teacher as to what is the higher priority work, what should they get done versus what is stuff that could wait to another day. I mean, maybe that will help manage some of the frustrations that both the parents and the children are experiencing.
But I thought your self-advocating comment was smart, and I think a lot of people are going to find that very helpful. We hadn't thought of that. As parents, we sort of try to get in the way and help and do the best we can, but at some point there should be a little bit of self-advocating on the part of a child, and that might even be in the quantity of homework or the schedule.
Yeah, I mean, as
smart answer.
Even when I meet with younger children, I always feel like they're the expert in the matter. They know what they're feeling. Their parent could be their spokesperson and kind of describe what they're feeling, but it's really the child. The child's the expert. So I think that in an appropriate manner, you want to coach and encourage your child to kind of tell their story. And certainly as the kids get older, I mean, it's easier for the kids, or easier to make it happen. I mean, some kids are a little bit more introverted, but I think, you know, again, that would be, yeah, that's what I always like to, you know, guide and try to help establish that within the individuals that I work with, for them to kind of tell their story, because, you know, the spokespeople are usually, you know, get some of it wrong.
Yeah. Well, I promise not to take up your entire dinner hour afterward. I think this is great. I got a funny feeling that we're going to get a slew of questions when this is over. So while I have you on the spot, maybe we could do another one of these in a week or so once we compile the new questions, because you gave some great answers to the ones that we had, and I really appreciate your time. I didn't know if you had any parting tips or tricks or some information or resources a parent could use to sort of get through this or help their child.
Yeah, well, first of all, thank you very much for providing me with this opportunity. You know, again, I defer to the schools. I think that you know, the mental health professionals in the Trumbull Public Schools are great. Had experience as a you know, as a professional, working with them, but then also, you know, I mean, you know, my own children, and you know, I've had questions as I've gone through the process too. The one thing I'll say is, you know, I will say this, you know, my opinions, you know, they're born from my experience. I know I'm not for everybody. Sometimes my opinions or my suggestions will work with some people, not with others. And, you know, I'm certainly I welcome any criticism that say, hey, you know, Pete, you know, that makes sense, but I don't know if that's going to work for me. So, you know, I don't know.
I don't think you're gonna that opinion thing. I find that in my own house that not everybody agrees.
Yeah. No, so I think, yeah, no,
there's anything to be criticized about, by the way. It's just information, and people can process it any way they choose. Maybe they take some of it and it helps them, which is the reason why you and I got together in the first place. Was we thought maybe we could answer some questions that people had, and people could find some peace or some strategies to help in their own life. I really think you've done that. So.
Yeah, and if there's one tiny morsel of what I said was helpful, then it's been a success.
All right, great, Pete. I hope to talk to you soon.
Okay, you take care. Okay,
Thanks
stay
very
healthy.
much.
Take care.